I had some pains in the knee, and I suspected that to be arthritis. And these are drugs are very expensive, and a common man cannot afford. But I'm getting them free, and I'm sure that is going to disappear. The pain, they have assured me, the drug they are giving me will take care of that. I also developed colds last night, a little bit sneezing and whatever, and I'm sure they will be able to address that small ailment and give me appropriate drugs which can clear that cough. You know, as a person, I was scared, although I pray, but I was scared when I got sneezing slowly, and I'm sure they are going to take care of that. Otherwise, I want to appeal to the public. Whenever they hear such, they should turn up in great numbers. Because I know some people in the village, especially in our area, they are just ignorantly suffering at home. One, because they cannot afford free they cannot afford even the fare to the main hospital, level 4 at the Makueni General Hospital. They cannot afford the fare, leave alone the drugs. Although we are having free medical care in Makueni, but some of them cannot afford the fare because they are right in the interior, and they end up taking just simple drugs from the chemists around, which may not be appropriate for their healing. So I will appeal to such people, whenever we have such free medical checkup, they turn up in large numbers because they will get the best services ever. Otherwise, I would request the proprietor to consider us very soon to bring the same service to us, and we will benefit our people. And I'm sure the people that have benefited today will go spreading that good gospel. They will spread the gospel to others, and we are expecting very many of them to turn up next time. Otherwise, I'm very, very, very grateful. My people have benefited. And it is not based here in the Redeemed from the church member, for Redeemed church members. No, it is for all people from all churches, the Catholic, the ABC, Faith Giroli, Full Gospel, AIC, MBC, have all come. And even those who don't go to church, they were welcome, because the underlying factor here is that to meet every humanity. Otherwise,
naitwa Mwamuga Matesia. Nilianza hii ugonjwa mwezi ya mbele, nikatibiwa, kaenda hospital Makueni. Alafu nikaandikiwa ndawa, ni daktari wa ngozi. Alafu siku ingine bwana yangu akapikiwa simu, akaambiwa iko mtu mwingine alifariki mahali fulani, na akakuja akaambiwa ni pastor wetu iko na usaidizi iko hapa. Ndio tukakuja kuangalia leo. Kwa vijiji wapimwe, waangaliwe kama iko na ugonjwa gani. Si najua wetu ni iko na ugonjwa mingi na wanalemewa hapa nyumbani. Si ndio?
My message to the youth is that they are supposed to come. I call upon them to come, get tested, get checked up, because some of the diseases come early in age. Like, for example, young girls, they need to be screened for breast cancer and cervical cancer. If they do the screening early enough, before this disease turns out to be cancer, it is treatable. But if they don't come, get examined for it, but wait to come later when the disease has advanced, it will be beyond repair. It will be untreatable. So I call upon them. Well, once they hear this exercise going around, to come and not to ignore. Thank you. So far, tumeweza fikia 1,000 plus patients, and we are still registering more number, and we hope to continue giving these services to reach as many people as possible, especially in this count of Makueni. Some of these diseases that we are targeting are non-communicable diseases, like diabetes, hypertension, rheumatoid arthritis, shida za macho, shida za meno. Tuko na madaktari ambao wanashughulika, even cancer screening, especially cervical cancer and the like. We are doing laboratory services whereby we identify diseases among patients and we treat them accordingly. Sisi kama One Way Wise Health Services tuliona ni vizuri kuanzisha hii program ya free medical services ambayo tulianza last month tarehe 15 na tumeona watu wakisaidika sana. Lengo la kwanza ili program ni tulitaka kufikia watu wenye wamewezwa na COVID-19, wenye wamepungukiwa na hela za kwenda hospitali na wenye pia wanaogopa kwenda pale hospitali. Unajua pale hospitali kuna watu wengi na wanaogopa kupata COVID-19. So tumeona ni vizuri tuwafikie katika vijiji, tuwahudumie na free medical services, ndio wenye hawawezi jimudu kifedha to make sure wamepata hii services, wasikue wameachwa nyuma. This county, Makueni County. So tumeona watu wakisaidika sana. Lengo letu la kuanzisha hii program ni kufikia watu wale hawajiwezi. Kuna watu wengi wamekuwa na uzito wa kupata pesa na ndio waweze kuhitimu hali ya afya. Hawajaweza enda kwa hospitali kwa sababu wamefungukiwa na hela. So hao watu ndio tumeweza kuketi chini kama One Way Wise Health Services ndio tuweze kuwasaidia. Tumeona hao watu wakikuja kwa wingi na kusaidika with our services. Tuko na madaktari wazuri wanawaongelesha patients vizuri, wanawatibu, free registration, consultation, even laboratory services we are doing, and people are getting help from this program. So far tumeweza kufikia we are almost 1000. We are actually 1000 plus. We have reached and we want to reach as more patients as possible in this count of Makueni. Some of the diseases that we are covering are like diabetes, hypertension, rheumatoid arthritis, ama kwa lugha ya kimombo mtambuko. Tunatibu watoto, wazee na watu wote, all the diseases. Meno tunashughulikia, tuko na madaktari wa meno wanashughulikia wenye wako na issues za meno. Madaktari wa macho, wale wako na shida ya macho wanashughulikiwa, na magonjwa yale mengine yote. We have specialized services. All the specialized services are done in our facility. So we call upon all the citizens, especially when hawajaweza kufikia hospitali kwa sababu ya shida, wakuje tuwasaidie kwa sababu tuko hapa kwa ajili yenu. We are giving back to the community. Thank you.
Jadet Zilani Chalo kutoka Makueni, na ningependa kushukuru hii clinic One Way Wise Health Service kwa kuja huku mashambani. Mimi kibinafsi naweza sema ya kwamba nimefaidika. Nilikuwa na shida ya niliweza kusaidika hapa, nimesema na nimeelekezwa vizuri jinsi ambavyo nitaweza kusaidika na jinsi ambavyo nitaweza kupona. Nimeweza kupata dawa na ningependa kusema asante kwa wana clinic kutufikia hapa. Kwanza ningependa kusema asante manake wakati huu wa corona watu wengi hatungeweza kufika hospitalini kwa sababu ya uhaba wa pesa. Nimeona wengi hapa wazee wameweza kufikiwa vizuri, wengi wako na magonjwa, na nimeona wengi wameweza kushukuru manake wameweza kufikiwa vizuri.
Mwikali Kingondu from One Way Wise Clinic or an hospital. Of late, we have begun to reach people in the rural areas because we have realized that there are some problems which are really affecting women, specifically women. Like of late, we have realized that the records are high in terms of the infections, especially the viral infections. They have affected so many women. And again, we have realized that there is a challenge to do with the fare for them to reach the hospitals. So that is why we have decided to go to to reach them in the rural areas, whereby at least they can come and get tested and at the same time get treated and at the same time begin the medical attention for them. So we are urging you women and even the young girls, because we have realized that so many young girls, they stay with this infection for so long without even noting or without even realizing that they have it. So you girls, the young girls, you can come just to get tested. It's not a must that you feel that you have it, but for being tested, that is very important for your health. And the women, especially the pregnant mothers, this is an infection which really affects them when they are in that state. So just come, it is free of charge, come get tested, come get treated, and that is for your health. So